right. Good morning, Ithaca and Tompkins County colleagues and friends. I am happy you are here. Welcome to Homeless and Housing Task Force. Homeless and Housing Task Force meetings are the education and outreach arm of the local continuum of care. We call ourselves New York 510, for those that are interested. We're a continuum of care that covers Ithaca and Tompkins County, and this is a space that has been held for years and years and years. I was just telling someone, I think the earliest Homeless and Housing Task Force dates back to the mid late 90s. And it's designed to provide education at sort of like a very approachable level for anybody who's interested in learning more about the homeless response system, specific programs within our local community, mainstream benefits, those kinds of things. It's public, it's free, it's for anybody. You tell your friends if you have people who are interested in getting more plugged into this kind of information that we're here. Um, Homeless and Housing Task Force meeting happens every other month. Uh, on even numbered months on the first Wednesday. I try to get it out there through the listserv and other places. Happy to share more information. It's a great place to be. I've seen amazing things happen that started in the Homeless and Housing Task Force meetings, through public engagement and then networking and getting to know all the programs that are happening around, in our community. And it has proven to be like an incredibly powerful resource, I think, for a lot of people. So glad you're here. Always happy when new people are here. Always happy when the same people are here. Thank you very much. Um, Welcome. The agenda is in the chat. I will put it in again, but I'm only really capable of doing one thing at a time, so bear with me. Um, I'm excited to get a really deep dive into some of the new stuff that's happening with the social care network and really like get a chance to like learn about what the enhanced services are and specifically the enhanced services about housing, but also like a full look at the whole shebang. And then when we're done with after that presentation, I am hoping that people will stick with us for an open discussion about advocacy at sort of a sector-wide level, especially like in light of the many shocking and fast things that are happening in our at the federal level. I want to hear about impacts that you anticipate or are already seeing or hearing about in your communities. Um, how these proposed changes align with the mission of the work that you guys are currently doing in your organizations and agencies. And then is there sector-wide or local or regional advocacy work being done around specifically, obviously we're in Homeless and Housing Task Force, right? So the folks that are doing any advocacy work around um, the homeless and housing response system. We want to hear about it. I want to talk about a little bit about what's happening that I'm aware of. So that is obviously optional, but I hope people will stick in it. And that is an open discussion. Like that's for y'all. There's no PowerPoint. I'll probably stop recording and I'm hoping that we can just have that conversation so that we can get our heads together as a sector. Uh, so great. Welcome. As always, we like to start our agenda with any updates or announcements specifically from people who are working in the homeless response, like directly in the homeless response system. So are there any announcements from the shelter providers, any basic needs providers, supportive housing, food pantry, those sorts of organizations that want to share anything? And I will tell you there's another crack in announcements at the end if people get excited and want to share something. How are things going, shelter and housing providers? Yes, Nicole.
I just wanted to share through our new partnership with the county. The 211 is the one call, one click center for transportation resources. We have developed a pretty strong sort of referral partnership with the Code Blue shelter. We have a number of clients coming in almost on the daily from our offices, which are a block away, for bus pass. So we do have bus passes available. Not a huge amount. We give people 5 days worth, up to 10 days worth. They come back the second time. And then we also connect them with more long-term option like Go Ithaca, who offers a 30-day pass that has to be received by mail. So we get them connected with that, sign up. So, and then using an address like OAR, now that's the address that is being used by folks since the shelter at St. John's closed. So just wanted to share that. If you have clients that have a need for bus passes, I'll put my email in the chat. They can connect with me and I can set up time for them to come in and provide them with some bus passes. Thanks.
Awesome. Thank you. Anybody else? Shelter folks, housing folks? All right. I'll give you another crack at the end. Never fear. So without further ado, I would like to introduce Nicole Cashman. I shared a little bit about her in the announcements I sent out, and the screen is yours. Welcome. Thank you for being here today.
Thank you. Thank you. So thank you everybody for having me. I am Nicole Cashman with Care Compass Collaborative. I am the Network Performance Specialist for Housing Services through the Social Care Network and the 1115 waiver. Really today is meant to be, even though there is a larger audience, an open conversation. We're going to review the social care network as a whole, kind of briefly go into eligibility criteria, and then really focus on the housing services that are provided through the social care network, and break them down. And my thought process right now is after each service, I'll open the floor for any questions because there are many services and I want you to be able to get your thoughts out after we review each service so we don't lose our train of thought at the end of the presentation. I have a PowerPoint. I am not the most tech savvy person. I will share that with you right now. So it may take me a little bit to get things moving. Can everybody see that? Of course, everybody on my screen. Yes. Okay, Sarah, I see you shaking your head. Thank you. So again, Social Care Network with Care Compass, our objectives really today are to do an overview of Care Compass Network and Care Compass Collaborative, review the Social Care Network and the goals, and then really look at the network eligibility criteria, discuss some metrics that are specific to Tompkins County, and then an overview of the available health-related social needs services, and then discuss the enhanced housing services, and then finally discuss the reimbursement for the services and what that looks like for the members. So quickly, Care Compass Network is a 501c6 organization. They were established as a nonprofit community organization in 2015, supports the transformational healthcare delivery through development of convening of strong and resilient partnerships. I'm really looking at that care coordination and reduction of healthcare expenses. At that point in time in 2015, Care Compass Network provided oversight and support to 9 counties that you see below. And it was the open network. And so Care Compass Network does provide services to these 9 counties identified. Then in 2020, Care Compass Collaborative, which is a 501c3, was formed, again, with the mission to foster integrated social and clinical care delivery and really preparing organizations to thrive and best meet community needs in a value-based payment environment. And then in July of 2024, Care Compass was awarded the Social Care Network lead entity for the Southern Tier region, which includes 6 of the 9 counties that were previously served. So the Social Care Network is comprised of Otsego, Delaware, Shenango, Broome, Tioga, and Tompkins counties. And sorry, that's 10 counties, not 9. So the Social Care Network, again, is made up of those green highlighted counties. Just another view at that. And for those who may be on this call that are outside of the Southern Tier region, which we are Region 6, the Southern Tier region, again, serving Broome, Shenango, Delaware, Otsego, Tioga, and Tompkins counties. This is a list of the other regions and networks that are provided. So each region has their own social care network that has been formed. The goals of the social care network are for Medicaid members, really expand that access to those high quality health-related social needs services, ensure that there's consistent timely screening using the standardized screening tool, and then navigating those members to those enhanced health-related social needs services. Creating that shared end-to-end visibility of the member's journey through the screening and navigation and then delivery of the services. So it's a closed loop system. And then strengthening that collaboration between the service providers and other partners in their regional health ecosystems, including providers, care managers, and health plans. So really looking at a diverse network coming together to meet the needs of the members within the region. So who's eligible for receiving services through the social care network? Medicaid member eligibility. All Medicaid members, whether they're fee-for-service or Medicaid managed care, who are provided with a screening, they demonstrate an unmet health-related social need, and are interested in receiving support for those needs, should receive an additional eligibility assessment. Now, consent is provided by that member through all steps of this process, and if the member doesn't consent to have the additional screening, then the services stop there and you provide support and direction based upon where the member has chosen to left off. We're meeting everybody where they are at with these services. So eligible populations, again, that Medicaid fee-for-service, they're only eligible for navigation. So we're navigating them to the current services that are existing, local, state, and federal services. Medicaid managed care members, they're eligible for the enhanced health-related social needs services through the social care networks. So there is specific criteria and eligibility and social risk factors that are required to meet eligibility for those services. And if they meet one of those during that eligibility assessment and they screen positive for one of those identified needs, they're eligible to receive those services. Some may be eligible for navigation only if they do not rise to the level of needing meeting that enhanced need, then we support them through navigation to the existing federal, state, and local services. Some of the populations that are eligible, that are the focus of the 1115 waiver and the social care network, are listed here. Medicaid high utilizers, individuals enrolled in health homes, adults and children, substance use disorders, intellectual or developmental disabilities, so adults and children, also individuals with serious mental illness, pregnant persons, and up to 2 months postpartum, or up to 12 months postpartum for high-risk members. Individuals who are 90 days post-release, so from incarceration with a chronic condition, including SUD and chronic hepatitis C, Juvenile justice involved youth, foster care youth, and those under kinship care who meet specific criteria. High-risk children under the age of 6, and then children under the age of 18 with chronic conditions. And then you'll see the Department of Health has, if a member is to be part of an enhanced population, the navigator is going to assess medical necessity using defined clinical criteria and then navigate them to the specific enhanced service. So that's a real brief overview of member eligibility and the criteria for that. Now we'll talk a little bit about the data and the metrics and really focus here. This is a snapshot of the entire Southern Tier region, but focusing on Tompkins County, really looking at your population. So the total population as of March of 2024, so we're getting close to a year old on our data. You can see the total population is 102,000. At that point in time, the Medicaid enrolled population was almost about 18,000. And then the Medicaid percent total was 17%. And the percent of Medicaid population across the county was almost 14%, and then 173 Medicaid per 1,000 population. So really utilizing those numbers to identify the saturation in the counties, the need for services, and where to deploy those services and what is needed. And as you can see below, by March 31st, 2025, the goal is to screen 64,718 Medicaid members throughout the region, the entire 6 counties, as one of the goals of the social care network. Again, just some more performance metrics. Really, Medicaid members in the region are going to be screened annually. 50% of that is the goal by the end of March. And then the end of March of 2026, the goal is 75%. And then the waiver does run through March 31st, 2027. And by then the goal is 100% of Medicaid population screened. So this is a screenshot of what health-related social needs services are available. So this is a really brief snapshot of all of the services. So we have the screening where a member can choose to be screened for services, and then they are then navigated to an additional assessment based upon their eligibility criteria, and they have to obviously the Medicaid managed care members. They're eligible for navigation to existing or enhanced HRSN services, and we have social care navigators that provide that service. Care Compass has social care navigators, and then many of our community-based organizations and our partners that we're contracting with throughout the 6 counties have identified screening and navigation as a service they would like to provide. So they then navigate the member accordingly based upon their screening results. And if they screen positive for navigation with an identified need to the enhanced services, then that social care navigator will navigate them to a community-based organization who is contracted with Care Compass within their county, either for nutrition, housing, transportation, or the social care management aspects. Housing services, this is a brief overview and a snapshot of all of the housing services that we'll discuss today. Medically necessary home accessibility and safety modifications, the medically necessary home remediation services, asthma remediation. Medical respite is currently not established in our region. So we're working with providers on becoming New York State certified to provide medical respite. So that service is currently not available. We do offer the rent and temporary housing services, the utility setup and assistance, pre-tenancy, tenancy services, that community transitional support, and then also the housing transition and navigation. So we're going to be talking about all of those, minus the medical respite today. So the first service is the home accessibility and safety modifications. This service consists of limited internal and external physical adaptations to a member's home or community dwelling, and really with the goal of ensuring, maximum health, welfare, safety, and for that member to be able to live independently in their home or their community-based setting. That is the goal in mind. They apply both to the individual's space, so a member's bedroom or bathroom, and then the shared spaces within the home. So it's not just focused to where that member would spend the majority of their time. All of the installation services, they include general education on how to use and properly care for equipment during the installation. And then a statement of work must be approved by the social care navigator as part of that process, which we'll dive into a little bit more. Some of the examples of accessibility and safety modifications are accessibility ramps, handrails, grab bars, electric door openers, widening of doorways and pathways, door cabinets and handles for modifications, modifying bathroom facilities for easier access and independence. Again, kitchen cabinets or sinks, lowering those to appropriate levels and making modifications as needed, and then the installation of non-skid services. Along with the home accessibility and safety modifications, home remediation, the mold and pest falls within that, with the goal of promoting a member's health and well-being. So really mold remediation, including fixing water leaks, removing damp or wet items to prevent mold growth, and then pest remediation, sealing, patching holes and cracks, through which pests will enter the home. These services do need to be provided by somebody who is contracted and meets the New York State local codes and standards, and for pest remediation holds the appropriate certifications. So if a community-based organization is offering to provide these services, whether it's the home accessibility and safety modifications, or the community-based organization is contracting with another organization to provide those services on behalf of the member, we just need to ensure that those agencies hold the appropriate certifications to provide services to that member. An additional service is the home remediation ventilation improving services. So these are medically necessary improvements to ventilation systems in a person's home. And utilizing air conditioners, humidifiers, dehumidifiers, heaters, air filtration devices in order to support the person in their home. These services can also be billed and under the asthma remediation services, which we will speak about a little bit further, but there are ways to coordinate different services and utilize the maximum amount of funding allowed for each service to make the most for the member. And then home remediation equipment provision is really providing a medically necessary mini refrigerator for individuals for medical treatment and prevention. Example is insulin. Another example is also breast milk for mothers who are nursing their children. So this is the reimbursement slide. I am not able to share actual fees for the services, as it is a confidential document that is provided region by region for social care networks. So once an agency is engaging with Care Compass and we're in conversations about services that'll be provided, we are able to share our fee schedule with those community-based organizations, because we recognize you need to make a decision based upon finances as well and the benefit. So the unit max you will see on all of these slides is blank just due to that. But it is a cost-based, and the unit max is inclusive of all of those services that we just reviewed. So the funding stream is inclusive of all of those services throughout the duration of the waiver. Again, the setting requirement is that the home is owned, rented, leased, or occupied by the Medicaid member or their caregiver. For a home that isn't owned by the member or caregiver, written consent from the owner for the physical repairs or remediation of the home will be required. So the social care navigator and the service provider, the HRSN service provider, will work collaboratively to obtain that written consent. In addition, if the individual, the member, does own their home, we also need to obtain consent in writing from them as well. So you could go through the entire process of identifying and screening for a need. And then if the landlord isn't willing to give written consent to provide those modifications, then the service would have to end at that point. The service provider would be able to bill for case management services up to that point, but just would not be moving forward with the actual repair and remediation of the individual's dwelling. So I'm going to stop there and see if anybody has any specific questions related to those services. Okay. In addition to,
Oh, it looks like you have a question from Teresa.
okay,
Sorry.
sorry, I can't see
The-
everybody. I can't see everybody.
The scariest thing that I see here is the little red pending CMS approval.
Yes, it's a living document. So a lot of the information here today has come from the operations manual, which is in its 3rd version, with a 4th version set to come out in March or April. So everything is changing, but there is approval at this point in the version 3 of the manual. We put that there as a disclaimer because it is a living document.
Veronica. Thank you, Nicole.
Hi, thanks for this. This might be super cynical, but how do you avoid or prevent a landlord approving these modifications for a Medicaid member that lives in their home, getting them billed by Medicaid, and then kicking the member out and just renting the improved space to a totally different person?
Yeah, I think that would probably, that's a very good point. It's something we haven't come across yet. As these services, the screening and navigation has been live since January 1st. I would say at this point, there is a additional service with that a members qualify for and it's the tenancy sustaining services, where you can provide the members support with linking them to free or affordable legal services for situations where there may be eviction or they're facing those housing related issues. So we do offer supports for that as well. But that is a true concern, as the individual may not be there indefinitely, and then those modifications don't travel with the individual.
Brett.
Yes.
Oh, sorry.
Oh, no, there are other criteria established through this process that the service provider would have to implement in regards to once they've accepted. So the referral is submitted to an organization. The organization accepts that they accepts the referral, says they can provide these modifications to the member. The community-based organization then has to provide a dwelling assessment and a safety assessment of that individual's home environment. And then they also have to complete that statement of work or that scope of work that we're calling it, and provide an estimate in regards to the cost of those services. So that is a step that the service provider needs to complete on their end. If the cost of services is over $2,000, then we need to have 3 bids for that job. If it's under $2,000, then we need to have 2 bids for that. And if the service provider who's completing the dwelling and safety assessment can be one of those providers bidding on the project. So essentially you would need 1 more bid in order to satisfy that need. We are in conversations right now because we recognize how difficult it is to obtain 3 bids and the kind of bottleneck that places on this service and for completion. So we are currently working with the Department of Health through a conflict of interest statement and with additional guidance on a time frame associated with obtaining bids. And really, it is up to the service provider to show that they've provided reasonable efforts to obtain those bids. And we're just looking to solidify that a bit more so that obtaining those 3 bids doesn't hinder the remediation process. The next service that is provided is asthma remediation, and this is the self-management education service. This service is required in order to receive the asthma remediation services and the installation and the supportive products for the service. So this is that educational component. And there are 2 required visits, the initial and the final. They must be conducted face-to-face in the primary residence. And they're really geared towards providing education to the member receiving the asthma remediation services. They must be provided by a qualified non-physician healthcare professional, so that certified asthma educator, a respiratory therapist, a health educator, or a community health worker. Needs to be conducted in alignment with national asthma guidelines and support education for a partnership in asthma care. And really tailoring that education to the needs of the member and the family to expand their knowledge around asthma and the services that are provided. And then after that, if asthma remediation referral is necessary, then a referral will be completed. Again, units are broken down for 15-minute units. So per 15 minutes is your billing mechanism with a max of 24 units for the waiver period. The setting is a single-family, multifamily unit owned or rented by the primary caregiver. And again, it's for the length of the waiver period. The asthma remediation and supportive products have to have a diagnosis of asthma and meeting the clinical criteria, which will be documented in their social care plans by the social care navigator. And really the goal is to remove those indoor environmental allergens and also provide supportive products to eliminate or reduce asthma triggers in the member's home. Again, tailored to the individual needs of the member who has the diagnosis of asthma. Really looking at indoor air quality, mold remediation and moisture, and that integrated pest control. So some additional services, installation of air conditioners, ventilation systems, upgrades, installation or repairs, whole house fans, cleaning of those heating units, tuning and repairs or replacing them if necessary, forced air filter replacement, and 6 additional filters. Or you need a replacement of the filters in the HVAC system. And then there is a list of asthma-friendly cleaning supplies as well, which goes towards those supportive products. Again, cost-based up to the cap, so there is a capped amount for these services for the waiver period, the individual's primary residence, and they are for the length of the waiver period. The same criteria for the home accessibilities as with the asthma remediation in regards to cost and completing the dwelling safety assessment and the number of bids required depending upon the cost. So those qualifying factors apply to asthma remediation services as well. Are there any questions on those two services? Okay. So for this next slide, it's in depth. I thought maybe it would be beneficial to kind of see it's a workflow of home accessibility and safety scenarios that can apply to the asthma remediation as well, but really utilizing the home accessibility and safety services. Just to kind of put it in real time, the step-by-step process, and what the service provider is responsible for, what the social care navigator is responsible for, and just kind of all in a snapshot. So I said Jane is screened by a social care navigator and is eligible for home accessibility safety modification services. She consents to the services and to be referred to the services. So the social care navigator sends the referral via Unitas, which is our IT platform that we use and the community-based organizations will use as well to track a member's journey through the social care network. So they send that referral via Unitas to an HRSN service provider. And I chose the Village at Ithaca, accepts the referral, and then they do the following. They will be the first contact to the member to initiate that dwelling assessment of the residents that I spoke about. That dwelling and safety assessment are completed by that provider, which the service provider can use their own dwelling and safety assessments that they have. There isn't a specific template that the state has provided us that you're required to use. And then they determine the adaptations and modifications needed to function in the home. And then the safety assessment is going to identify potential issues or barriers that might hinder completion of the modifications. And then that service provider also develops that statement of work. The service provider is responsible for updating Unitas, noting the completion of the assessment, and provides that social care navigator with the statement of work that outlines the services. You're going to have the estimated cost and line items for administrative evaluation and/or those coordinated costs. So a little bit about that piece of it with the administrative evaluation and/or those coordinated costs. Those can also be billed under our care management, case management services. So if you're looking at coming up close to the cap for this service, you have another funding stream within the social care network to bill for those administrative type services that you're providing in this initial assessment. So they don't raise the cost of the actual services being provided. So the social care navigator is going to review that statement of work. They select the appropriate authorized services that meet the criteria, because that service provider may have identified services within that statement of work that aren't authorized services within the enhanced services criteria. So we need to remove those from that process moving forward. It is then the social care navigator that informs the member, and then the member is going to approve those services. And then authorization from that lead entity is provided. So Care Compass then provides authorization. They review the form in Unitas and provide authorization for that service. There is also a reject button if there's an error in the documentation. And then there's a drop down where we will notify you of a modification that needs to be made before we can approve. So we will go through that process. And then the navigator notifies the service provider of the authorized statement of work. They accept the referral, and then the bidding process starts, which again is what I just previously explained. And then the service provider or that subcontractor that I spoke of that you may contract with is going to obtain the written approval from the landlord or the member to complete the scope of work. Also need to obtain permit approvals if necessary, and then share them with the social care navigator. The service provider or that subcontractor is going to complete the modifications and then a final evaluation to ensure they're complete and accessible in meeting the needs of the member. And then the service provider updates Unitas to demonstrate services have been completed, submit for billing, which is a 30-day reimbursement cycle. And so that overall is the process for home accessibility, safety modification, asthma remediation services. Are there any questions on that? Okay. Next is rent and temporary housing. So I will say that rent and temporary housing services are required in order to receive some of the services we're going to talk about, such as utility setup and assistance. So please just keep that in mind. The member does need to be receiving rent temporary housing in order to receive utility setup and assistance services. So the service delivery, it is payment for rent, short-term temporary stays, and the security deposit up to 6 months. And it's based on, the U.S. Department of Housing and Urban Development fair market rate. The SCN, we will provide the payment to the entity providing the enhanced HRSN services or to the housing provider. This payment will not be made directly to the member. It is a per unit per month, limited time for up to 6 months. And then you will see that our housing costs will range and the reimbursement will range from studios up to 4-bedroom units. So I added the criteria for rent and temporary housing because it is probably the basis for a lot of the services that individuals and members will receive. So the eligible population has to meet at least one of those enhanced services. So again, members with substance use disorder, serious mental illness, the intellectual developmental disabilities, frequent healthcare users, so emergency rooms, hospital stays, or somebody transitioning from an institutional setting, or members enrolled in a health home are just some of them. Social risk factors, they are homeless or at risk of becoming homeless, as identified by HUD. And then the clinical criteria is, again, that chronic condition, physical disability, transitioning out of congregate care settings, nursing facilities, correctional facilities. And if you've had an acute hospital stay within the past 90 days, again, individuals that are homeless by the definition, and then youth transitioning out of the child welfare system, including foster care. The member must be enrolled in the Medicaid managed care, and members who are willing and capable of living safely within the community with appropriate cost-effective supports and services, and that'll be documented in the member social care plan. Are there any questions on rent and temporary housing?
I just had a question. So it can only be used for temporary housing?
No, it's rent or temporary housing.
Okay.
I've heard different interpretations at different presentations.
Okay.
This can be used both for people moving into new housing if they're homeless, or in current housing if they're at risk of homelessness. Is that correct?
Correct. So it's rent and or short-term temporary stays, and it includes a security deposit for up to 6 months. It can be for an apartment, single room occupancy units, multifamily homes. We have co-housing communities, trailers, manufactured homes. It can be a motel or a hotel as long as that is identified as the member's primary residence at that point in time.
And
And
Oh, go ahead.
I was going to say, and the 6 months, this can be used for arrears, rental arrears, and is that included in the 6 months?
That it does include back rent. I would say yes, that would be included in the 6 months.
Okay, so if somebody is 3 months behind, they could get 3 more months of rental assistance.
Moving
Correct.
forward, correct.
Okay.
Yes, and there is, first, I know this does state for the use of security deposits, but there are the community transitional support services that also cover security deposits. So really utilizing the services appropriately, once that individual secured housing. That's the difference with the community transitional supports, that the member has secured housing, and then you can utilize the security deposit through that funding stream and save the rent temporary housing for.
so I'm trying to understand if someone were to try and um use their Medicaid for rent or temporary housing, exactly what is the process the client would go through? I know you sort of walk through that, but would it have to be through Care Compass, or how? Just
So,
an overview of
so if a member, if an individual comes to Care Compass or any other agency in Tompkins County that completes screenings for the social care network,
Mhm.
and that individual was identified as having this need and needing this enhanced service, then yes, through the social care network, we would provide them the supports of the rent or the temporary housing.
And the list of agencies participating in the social care network, would those just be continuum of care agencies, or?
So we don't have, well, I do not believe that on our Care Compass website at this moment, we have a list of the organizations by county. For Tompkins County, Nicole Zulu is the ambassador. So she would have the list of organizations that are active, or she could connect you, as could I, to that list of organizations that are active in the social care network right now. There are 11 currently contracted organizations in Tompkins County. Not all of them may be providing this service, though.
What's the best contact information for you and for the other Nicole?
For me, it would be N. Cashman at Care Compass Network.org.
Great. Thank you so much.
You're welcome. Oh, I'm probably sharing the wrong screen now.
Put the contacts in the chat.
Nicole Zulu's is in the chat.
Yep.
Thank you. Any other?
Nicole, I have a question. This is Keith McCafferty from Law New York, and we
Hi.
represent tenants who are maybe facing eviction. So if we have a client who is a Medicaid recipient, maybe behind in rent or maybe transitioning to a new place to live in and may qualify, but we're not sort of enrolling folks, I assume that we could refer our client to one of the agencies in network that can do the screening and then they can help the client through that Medicaid process. And we would work with them to try to work with the landlord and the court and resolve the issue. Does that make
Correct.
sense? Yes. Okay,
Yes,
thanks.
correct.
And Nicole, if I'm correct from, again, previous presentations, organizations like Law New York, and I work for DSS, we could also administer the assessment, the initial assessment, correct?
So, local county governments, DSS, are not reimbursed for completing the assessment with members per DOH guidelines. So while we believe that local government DSS we need that support because you see high Medicaid utilizers and people who meet the eligible population and criteria. It's not a reimbursable service for you at this time.
Right. I'm not asking if it's reimbursable. I'm saying that we could still
Yes.
administer the assessment, because if somebody is right there, rather than referring them,
Yes, Care Compass Collaborative website has a link to a self-screening assessment. So you could sit with that member and guide them through that self-screen as well.
I just put that in the chat, the website for the self-screen.
Okay. Okay. There's no other questions. We'll move on to utility setup and assistance. Again, as I said before, limited to those members receiving rent or temporary housing. And it's in your new community living setting. May include one-time activation costs, back payments to secure utilities, and then the payment for up to 6 months of utility cost. So below are some of the utility services that will be covered. And just a note, the phone lines, cell phone service, it is for one cell phone in that qualifying member, on that qualifying member's plan. I know there are many of us who have up to 6 or more phones on a plan, but this will only cover one cell phone on a plan. Again, the utility activation provides the payment for a non-refundable, non-reoccurring utility setup cost or restart cost if the service has been discontinued. So if somebody has lost their electric, we can provide the payment to restart that service. Again, it's in a new community living setting and it's a one-time cost. That back payment is that one-time payment, self-explanatory for utility back payments. Utility assistance covers up to 6 months of utility cost. So again, that may add some clarification to the previous question, because utility back payments is a separate category from utility assistance. It doesn't delineate that in the rent, but I will follow up on that. So it does look like you could provide a one-time payment to catch up on back rent and then move forward for 6 months with utility assistance in this case. Although the same doesn't appear to be for rent and temporary housing at this point. Any questions regarding the utility aspect of services? Okay. So then we have the pre-tenancy services and the reimbursement for those. So really it's assisting that member with the complexities of the housing search. It can be the application process, including contacting prospective housing options for availability information, researching and availability of rental assistance, lease agreement negotiations, preparing for an interview, tenant screening assistance, supporting them through that housing search, and then researching availability of rental assistance. So again, this is a service that is provided in 15-minute increments with a max of 24 units over the 6 months of the waiver period. There's not a required setting for this, and they do not need to be consecutive months. So community transitional supports, these are for members who have secured new housing, as I said before, really to ensure that they have a smooth transition to community living. And the member must be assessed and their need for any of the following should be in their social care plan, and that the social care navigator will manage that. So it's assistance with the setup of a new housing unit, really giving an assessment and a review of the living environment to make sure it meets the member's needs, clinical needs, furnishing, safety, adaptive, does it need any environmental modifications, and then also that food and clothing needs at the transition. So again, the following are one-time transition and moving costs. So this is where that security deposit comes in. So if somebody is transitioning in as identified housing, utilizing the community transition supports for the security deposit would be appropriate. You can also utility activation fees, so it doesn't have to come out of the utilities category. For movers, relocation expenses, if there are any needs for pest eradication and inspection fees, pantry stocking for food, so providing that member with a maximum of 30 days of food, also purchasing those household goods, furniture, pots and pans, bathroom, you see the list, getting their basic needs and the environment met. You do see the note, purchases must be reasonable and not considered luxury or designer label items, but really what does that person need to move into that home and be successful? And it's a one-time expense and doesn't continue after the individual is stably housed. Again, it breaks it down into the rates from a studio to a 4-bedroom. And you see the first month's rent should be paid using the rental subsidy service. Nicole, I see you have your hand raised, but that's all I can see.
That's fine.
Yeah.
I guess I could have waited until you called for questions again. Just to quick on like the mechanisms for paying for these items. Is that still to be determined, or
The mechanism for paying for the
like
different items?
The furniture and yeah.
Yeah, so at this moment in time, the cost would be on the service provider, and then the service provider would be reimbursed through the social care network lead entity. There are continued conversations regarding some of those higher ticket items and also relating to the home accessibility safety needs, where we recognize that it might be a burden for the service provider to have to provide that funding upfront and then wait to be reimbursed. So Care Compass is determining right now if we would be able to provide those costs upfront for the member, and then so the reimbursement would just be to ourselves. So it didn't have to directly come out of the service provider's funding stream. But for the time being, yes, it's on the service provider to provide that upfront cost.
Nicole, is there any criteria that for actually for any of these services that the participant needs to apply for other available funding before looking at this, or this can just be the mechanism by which?
This can be the mechanism because they've gone through that screening process to where if they weren't identified with that enhanced need, they would have been navigated to the current local, federal, state supports that are within the community.
Okay, thank you.
You're welcome. The next service is that tenancy sustaining services. So really the member has obtained the new housing, how do we support that person in sustaining their tenancy, and, you know, providing them some of the tenants' rights and education and that eviction process that somebody spoke to in the beginning of the presentation, really assisting the person in securing the housing and having that seamless transition. That's where I spoke previously about linking them to free or affordable legal services for members facing housing related issues, connecting them to available resources to assist in establishing bank accounts and paying their bills. Connecting them, these are a lot of the case management, connecting them with social services to assist with filling out applications to obtain sources of income. So what services do they need to sustain in their current environment in transition to maybe those local, state, and federal services that aren't considered enhanced once they've secured housing. And again, just some additional services. And it is defined, again, the billing mechanism is 15 minutes of engagement, 24 units a month, up to 6 months of the waiver period. And again, they don't have to be consecutive months. But this does not include payment of rent or other housing costs. Any questions on that service? Okay. The final service, housing transition and navigation services. Again, assisting somebody with navigating and transitioning into that new home. So setting up their home, the clinically appropriate residential modifications, coordinating moving and supporting them with the details of that move, connecting them to resources, aiding with housing costs and other expenses, linking them to housing vouchers for rental assistance, security deposits. So what are those transitional services? Again, after they've transitioned into their new home, that's going to help them sustain. So really more case management, navigating to existing current services. And again, ensuring that their environment is safe and meets their clinical needs for them to be independent. And again, it's 15-minute increments, 16 units a month, up to 6 months. And it's for those people transitioning into a new home. The duration max is 4 hours a month for a max of 6 months. And then finally, this is the reimbursement for HRSN service provision and ensuring that you qualify. So you need to be contracted with Care Compass as you're in the Southern Tier region. So we have a regional fee schedule that has been established. And you may be paid for, this is specific to screening and screening services. Again, if you're contracted with us, if you were referred to the service provider through the network by a social care navigator using the Unitas system. If a member is referred through an alternate pathway outside of the social care network through an existing grant program, the provider can't bill for services delivered to the social care network and should use existing funding. So we have that braided funding mechanism, right? Like we can't duplicate services. So we can braid our services together if we're receiving funding from a different grant to provide similar services, but we can't duplicate our services. So to make it whole, we can braid them together. If the service provider thinks the member's eligible, the service provider can direct the member to the lead entity to get a referral. And then they need to be enrolled in Medicaid managed care, meet that enhanced population criteria, identified with an unmet need, and then services are delivered within the program. And there is a link as well to the SCN program and the operations manual, which is about 285 pages. I'm sure many of you have read it already. And then the service provider contracts with the SCN lead entities. We have an agreement in terms that are outlined, and we begin services. Just here, I believe Liddy may have already have put Care Compass Collaborative's website in the chat, but there's the link again. A phone number for community members. So if you are serving anybody, there's the phone number for them to reach out for screening services. And then there's also the email address for the help desk for Care Compass. And then these are, this is my contact information, but these are additional network performance specialists. For transportation is Kathleen Blaine. So if you need any transportation related needs or questions as the service provider, Kathleen would be your contact. So there's her information. And Maria Musser is the network performance specialist for nutrition. So any organizations that are looking to support the social care network with nutrition services, Maria is your contact. Does anybody have any additional questions?
Thank you, Nicole.
Okay.
That was a robust presentation full of information. We did record it. I will send it out or let people know or whatever. We'll put it on our YouTube channel, which is linked to our website. I will send out any materials you want me to send, or if people want the PowerPoint. I don't know if that's available, but if it is, I'd be happy to send it. No? Okay.
No.
Okay. I'll send all the materials that I've been putting in the chat, the website, all of those things. People who want to learn more can get in touch with HSC folks, where we are the sort of ambassadors as part of this project, or directly with Nicole or anybody that strikes their fancy to ask more questions from today. Thank you very much, Nicole.
Thank you. Would you like me to leave for the advocacy?
Oh, no, you're welcome
conversation?
to stay.
Okay.
We're in
Okay,
a
thank you.
public, this is a open to the public, free and open education and advocacy and outreach
Great.
space.
I'd like to listen. Thank you.
Great. I am going to stop recording though, just because I am.